Dear colleagues, good day. Thanks very much for giving us the opportunity to address the participants and the audience in that very important conference taking place in Kazakhstan. We have prepared a presentation for you that focus on areas of the work of the NCD office based in Moscow. Today I will mostly focus on areas which I believe are relevant for Kazakhstan, including the ones around nutrition, particularly salt reduction, trans fat elimination, and other types of interventions that are really critical to reduce premature mortality, particularly by cardiovascular diseases. My short presentation is really to frame our work and to share with you in terms of the achievement of the Sustainable Development Goals. As you all know, nutrition is central for the Sustainable Development Goals, mostly for SDG 2 and 3, which are about, eliminating all forms of malnutrition, and Sustainable Development 3, which is more centered on health. But really, nutrition plays a crucial role in most of them. 17, which is about partnerships, the one about life in oceans or in land, and also about education. All of them, one way or the other, as you can see illustrated in my next slide, are influenced or where nutrition plays a very significant role. So all countries need to address and to achieve the Sustainable Development Goals. Is relevant for developing and highly developed countries. Therefore, Sustainable Development Goals are for all, with the motto, leave no one behind. So we have to ensure that no one is left behind, and really healthier nutrition, better food systems is really critical so that we ensure that we leave no one behind. If we look at the situation in the WHO European region with 53 countries, which is the biggest in the world in terms of number of member states, we're actually doing quite well in terms of progressing towards achieving the Sustainable Development Goals. Our premature mortality, which is a very important health-related target, is moving in the right direction. It looks like the WHO is going to achieve, overall WHO Europe will achieve the target by 2030, but we have the main issue for us is the inequalities within countries and between countries. So closing this gap, not just between countries and inside countries, between regions, but also between genders, men and women, is really very important. It is one of the critical aspects, particularly in nutrition, that we have not been addressed so well. Having said that, we really need also to focus on children. We have issues, particularly in Europe. One of the main challenges is around overweight and obesity in children and adolescents. You can see here on this slide, you have an illustration of the prevalence of overweight, which is around 25% all across the studied countries, all across Europe, those countries that have been working with us on the childhood obesity surveillance system. Also, in the context of the HBSC, we see an increase in the prevalence of adolescent obesity, particularly in Eastern European countries where the prevalence is lower but is growing faster there, and therefore very significant challenge to achieve SDGs because of the negative impact of non-communicable diseases. Well, why is this? Well, it's to a large extent because food environments are really problematic. They are not really health promotion as much as we would like. We know that fruit and vegetables are not there as they should be. We know that we have more and more processed foods, depending on how we would like to classify it, but foods certainly with too much sugar, too much salt, too much fat. Trans fats are still too prevalent in Europe, although we are confident that the European region is going to be the first in the world to be completely trans fat free. We already have about 35 countries with a ban on trans fat at the moment, but we have to do more. But for example, sugar is related with childhood obesity. In this slide, you see that there is we show as an illustration the amount of sugar in a very famous soft drink, worldwide famous one. And you can see the differences of this, of sugar in this soft drink, the very same one, for example, in the UK or some countries in the UK compared to eastern part of Europe. So for the same drink, that apparently tastes the same. You can have from just above 20 to almost 40 grams of sugar. So it's just an illustration on how food systems are interlinked in all these countries, and how we need to do more to make sure that we follow the best in class, that we follow best practices, and that we change our food systems and our foods in a way which is really conducing to better health and the promotion and the prevention of non-communicable diseases. Heart disease is the main cause of death. Cancer is increasing in many countries, and we know that, for example, overweight and obesity is related at least with 9 cancers. So we really need to pay attention to this. One of the main challenges in Europe where we're really not making enough progress is around salt. No country in Europe achieves the WHO recommendation. 5 grams is just a dream. It's like a mirage for most of the countries. We have countries where consumption is around 17, many with 14, 12, 13. Most of the countries actually around above 20 grams of salt, which is just the double of the WHO recommendation. Countries in the Eastern Europe, in the eastern part of the European region, their level of salt consumption is almost 4-fold the WHO recommendation. So if you ask me what's the main single thing that we should all be doing together to save lives, salt is certainly probably at the top. We also need to look at early development and take a life course approach. This slide illustrates breastfeeding. Breastfeeding in Europe is really bad. We are the worst region in the world. We need to improve the levels of breastfeeding. We do have some countries that are doing well and some regions in countries, but we really need to scale up actions to better use the benefits of breastfeeding to promote development, but also to protect our children from later non-communicable diseases. Therefore, we're not really using to the full extent the potential breastfeeding, for example, and then complementary feeding is also relatively problematic, with the quality of commercial baby foods being a big question mark in Europe at the moment. So we know all of this. We know health determinants. We know risk factors. Just in this slide, there's an illustration of some: obesity, alcohol, tobacco. In this slide, you can see that it's all red, meaning basically very few countries are going to achieve the targets in the context of the SDGs by 2030, and therefore it's time to deliver. We know what needs to be done. We know what works. We have the best buys list of actions developed by WHO and also other partners. Therefore, it's really time to take action. We don't have many years to 2030, so basically it's just 10 years to achieve all these targets, and as you can see, many of them are very challenging, are going to be very difficult to achieve. In the area of food, why is that? Well, because there's a lot of unfinished business. So in this slide, when you see the green, means that countries have achieved it, but you also see a lot of amber and red, meaning that countries, for these specific topics, being it marketing of foods to children, being it trans fat elimination, being it salt reduction, or better labeling, for example, the large share of our countries are not at the top yet. They are not yet, implementing these policies to the full extent. And therefore, this is the reason we believe why we are not there yet in terms of being, totally geared and in the right direction to achieve the targets. So in other words, we really need to scale up the actions, do more to achieve the different targets in terms of nutrition. We know what to do in terms of food and nutrition of food systems. There is a very advanced and very innovative food and nutrition action plan already adopted almost 5 years ago, which frames the actions for the WHO European region. It's very much in line with the SDG goals and targets, as I said before, and it should be, it's the inspiration force driving the actions that we need to put forward in Europe. It contains 5 main pillars, main objectives. One of them is really about creating food and drink environments which are more healthier. It's about better labeling. It's about food reformulation. It's about eliminating trans fat, less salt. It's about also less sugar, but it's about better school nutrition, better foods in hospitals. It's about also making sure that we promote more fruit and vegetables and more whole grain foods. So in a nutshell, it's very important that we take these behaviors forward, but to promote them, they have to be accessible to people. These behaviors sometimes are difficult. If we don't have healthier foods in hospitals, how are you going to get there, to get them if you are working there, if you're a doctor or a nurse there, or if you're going there to, to go over a treatment or something like that. So we really need to make the healthier choices, the easier choices, and make them more available. A lot of work needs to be done more in this area, and we are not there yet. We also need to take a life course approach, as I said before. Nutrition for the seniors is very important. We have not been paying enough attention to this, of course, in connection, again, with physical activity and other behaviors. Early nutrition, nutrition during food, and food during pregnancy, the role of breastfeeding, complementary feeding, school nutrition, the importance of adolescent years, it's really absolutely critical. Also, health systems. Definitely, in the context of primary care, we need to be better prepared to address issues of food and nutrition. Most people that primary care doctors and nurses see in European countries, they have problems related with hypertension, with diabetes. Sometimes, the issues of also cancer, which are very complicated. And much of this is generated by behaviors which are related with diet. And much can be done, particularly in the primary care setting, in terms of shaping better diets and healthier behaviors. We are not yet exploring the full potential, for example, of interventions to advise and to prescribe, for example, healthier nutrition and physical activity. Many countries taking action there, but it's not yet mainstreamed, and we need to do better there. Also, what gets measured gets done. So we really need better data around food and nutrition. I know this is one of the main topics of the conference today. So from data to action, what gets measured gets done. It's very important that we have surveillance systems in place, that we know more about nutrition. Most countries in our region don't have regular food and nutrition service. We need to look into big data and other opportunities to really collect better data for nutrition. And we haven't been doing that very well so far. So this is an area of priority for us as well. Finally, we need to work across sectors. We need to work with other areas beyond health, by far, agriculture, across government, different levels of government, with the private sector and others. So forging alliances is absolutely critical, and I think we need to do that. Of course, conflict of interest is always at stake when we talk about working with different partners, but that shouldn't stop us to engage, and we need to engage in a transparent and meaningful way. So we really need to do more about that. We are ready to support, systems to advance these areas. I have a few examples where we've been working in this area, particularly of knowing more about food systems and information. One of them is on baby foods. Just to illustrate in this slide the work that we have done around the quality of baby foods, where we also end up proposing a system of nutrient profile tool for member states' consideration as well. So WHO is really very much looking forward to work with you. We really found out, we could document that we have serious problems with baby foods in Europe, and that we really need to do more. Another innovation area where we're really looking and working around data is digital marketing of healthy products, particularly of foods, and we have developed a tracking method and a system to look at the prevalence of unhealthy food marketing in the digital world, so in social media and others, which is a very very striking, very difficult, very challenging area, but we as WHO, we're working with member states and our partners to support that. So very much looking at, big data, as I said before, but also new areas where our intervention could be effective. So in a nutshell, and as I finish, just to say, what perhaps could be done in the European region, and would like to stimulate the discussion with you. By the way, I regret I cannot be there physically, but I mean, you know, this day is is a day where we have many requests to be in many places at the same time, and I was already committed with something else. But, you know, in a way, I think this can be useful for the discussions. We really think that we need for the future and looking ahead, we need to seek more policy coherence and coordinated action when it comes to food and nutrition, taking a food systems and environmental approach. We really need to empower consumers, ensure access to affordable, healthy diet through healthy food environment policies. So the issue of environment very critical. We need to work with different stakeholders. Obviously, the issue of resources is very important.